Hello, my name is Maria. I'm here at Great Smiles of New York Dental Office, and we get a lot of questions about dental x-rays. I would like to answer some of those today so that maybe it will help with your questions. Dental x-ray is an image taken of the teeth to see a two-dimensional image of the tooth through and through in order to diagnose any potential problems with the teeth and the bone around the root of the tooth. It will show something like an infection, it may show cavity, it may show bone loss. So any potential problem with the teeth will be shown by the x-ray. Whenever you come in for your exam and cleaning would be one time that we take an x-ray in order to see if there are any changes from the last visit. Another time is when you experience some sort of pain or discomfort and you come in looking for help. Doctor will take an x-ray as a proper diagnosing tool to see what might be going on with that tooth. So the purpose of dental x-ray is to have an image of the tooth, sometimes an area that is not visible clinically when just looking at the mouth, at the teeth. So the areas between the teeth, areas under the gum, the bone, the root of the tooth, to see if there are any problems that are happening right now or potentially may happen. There are different types of x-rays that are being used for diagnostic purposes to see what's going on with the teeth, just to make sure that things are still in a good condition. Number one is a big panoramic x-ray that is taken of the entire mouth, all of the teeth in one shot. That is good to see how the wisdom teeth are growing for people who may be missing a lot of teeth, and also to see the condition of the bone. People who may be thinking of getting braces, panoramic x-ray will also be taken just to see the positioning of all of the teeth. Another type of x-ray is the one that you would be getting during your emergency visit or during your regular exam and cleaning appointment, just to see what's going on with the tooth that might not be obviously visible through just looking at the teeth. Dental x-rays became extremely safe in recent years with the introduction of digital x-rays. They use absolutely minimal amount radiation. You may potentially get more radiation just by walking outside on the street. So they are extremely safe. Even a big panoramic x-ray that used to be in radiation equal to a chest x-ray right now is very safe to take using minimal radiation, and it will not affect your health. The x-ray will show the anatomy of the tooth and the bone. You will see the crown of the tooth, the root of the tooth, the bone which supports the tooth. All of that is clearly visible on the x-ray. We can also observe any infection, any cavities, and even the tartar that is growing on those teeth. Those are the perfect diagnostic tools for us to see what treatment you may need to do in order to achieve your oral health. Dental x-rays don't specifically show periodontal disease, but they show the signs of it. The destruction of the bone, the tooth losing its support. Those are the great signs of a periodontal disease that are readily visible on the x-rays. Dental x-rays are covered by the insurance as a diagnostic tool, and most often they are covered fully. Dental exam needs to be scheduled twice a year for best results so that we stay ahead of any potential problems. When we see you regularly, we're able to catch anything in its earlier stages and we can address it before it turns into something major, costly, and painful. I hope I was able to answer some of your questions about dental x-rays. If you have any further questions, you're welcome to call us at 718-275-7300 and we'll be happy to answer your questions. We will also gladly schedule your appointments for your exam, cleanings, or any other dental needs you may have.